Hello, my friends, and welcome to the Pathway channel. Today we will discuss the tubular adenoma. Just to remember, it's a benign condition, but it's pre-malignant, and the best indicator or predictor to carcinoma risk is the size of the adenoma itself. It happens more in males than females with a ratio around 2:1, and it is asymptomatic, but it may present with some rectal bleeding if it is distal. So on the microscopic picture here, this is the 2.5x, and I want you to see here, this is the colonic mucosa, and this ink, we do it just in case if it is a malignant condition, we need to know the margin. And I want you from the low power just to recognize and appreciate one thing, which is the difference in color between this area and this area. Okay, as you can see, this area is more faint or more clear. This one is more busy and it's more bluish in color. And this is because the normal is to have the crypt to grow from the basal side to the surface. But in the tubular adenoma, we will find that the surface crypts themselves, they are still proliferating and they are immature. That's why we'll have this hyperchromatic or bluish discoloration, which is evident at the top of or the surface of the mucosa rather than the base. So we will find from the low power also, I want you to appreciate how the crypts at this or in this area, it's more crowded than beneath. Okay, and how the shape of the crypt itself is changed. The other thing is that they are more elongated. As you can see here, they are having this elongated appearance rather than the circular appearance, which is in the normal crypts. Here we can find another elongated one, another elongated one. They are mostly all elongated. Those are circular. Once we mention tubular adenoma, we know that we have dysplasia. But the question here is whether the dysplasia is of a low grade or a high grade. And this, we can know this on the high power. So we will go on high power now. So let's go first at the 5x. And I'll go through the slide with you. So this is the surface of the crypt, and I think you can appreciate this bluish discoloration, which is caused by this pencilate-shaped nuclei, and the difference between this surface or this area and this basal one. The basal one, the nuclei, they are basal, and they are not this pencilate shaped. That's why the crypts look more clear. But here, the nuclei will start to have this immature pattern, and that's why it's more bluish in color. Also, the elongation of the crypts, as I mentioned on the low power, here it's more appreciated. And now will come the question whether this one is of a low dysplasia or has high, or it's highly dysplastic. And we will answer this on a high power, but just to remember that with high dysplasia, there is loss of polarity, meaning that the nuclei will not be present at the basal side of the cell. It will be present at the upper side, and this is the loss of polarity. And we will have some dysplastic features of the nuclei itself, maybe more rounded nuclei and more open nuclei. Maybe we can see some nucleoli inside. So let's go at a higher power, and so we are now at the 10x. Just here, this is a great example for the difference between how the normal crypt will look. Like all the nuclei, they are very basal here. They are not evident. And here the nuclei, they are apparent. So let's go through this again, and I will go at a higher power to see whether we have any loss of polarity or any cellular or cytological features of dysplasia or not. We are now at the 20x, and as you can appreciate here, you will find that the nuclei, they are as if doing a pseudostratified pattern, but they are all basal. And this is the lumen of the crypt, and these are the cells. They are all arranged. We don't have any loss of architecture, which we appreciated from the low power. And now the nuclei, they are pseudostratified, but they are all basal. So the diagnosis for this slide will be tubular adenoma, negative for high dysplasia. And for this patient, he will do the follow-up of colonoscopy on a regular basis, or as per the screening recommendations. Thank you for watching the video, and please like and subscribe.